Hello everyone. Today we'll discuss about the clinical manifestations of inflammatory bowel disease. As we know, we have ulcerative colitis and Crohn's disease under IBD. We have certain similar features among them and slight differences among those signs and symptoms. We'll see what are those. So before going into the uh, differentiation of the features, we'll see some of the common features among ulcerative colitis and Crohn's disease patients. So, this is an inflammatory bowel condition, inflammatory bowel disease overall. So, here there is, as there is inflammation of the digestive tract, there is diarrhea, and because of diarrhea, there is loss of nutrients. So, there is malnutrition, which is common in both, but it is more in Crohn's, less in UC. Like that, we have uh, some of the features which have slight differences we'll discuss. And apart from these, the diarrhea, the patient also experiences tachycardia because of loss of fluids from the body. The person can become dehydrated, and to meet those needs, tachycardia can be there. As I told, dehydration, and some other common features include fever, diarrhea, tachycardia, dehydration, and also anemia are somewhat common in ulcerative colitis and Crohn's disease. Now we'll see the differentiating features. These can be in terms of fever, diarrhea, abdominal pain, abdominal mass, the signs of malnutrition, bleeding through rectum, so rectal bleed, and anemia, elevated CRP, ESR, reduced albumin in blood. So we call it hypoalbuminemia. And apart from this, even I'll just write it here as there is no space. Weight loss. Now, one by one, we'll see how much is the intensity. Weight loss. In ulcerative colitis, also patients may experience weight loss, but this is less compared to Crohn's disease. There is about 30% of weight loss, uh, minimum 30% of weight loss in patients who developed Crohn's disease over few days or months. Weight loss also occurs in UC, but it is less compared to Crohn's disease. Fever. So fever is common in both ulcerative colitis and Crohn's disease. In diarrhea, so diarrhea, here we can see mucus and it is bloody diarrhea. And here also diarrhea can be seen with mucus, but there is no frank blood in it. So obviously rectal bleed is common here and is not significant in Crohn's disease. In abdominal pain is variable. It's not experienced significantly by a patient suffering from ulcerative colitis, whereas abdominal pain is common and is present in Crohn's disease. Now, malnutrition. So, before that, abdominal mass. Abdominal mass is absent. Here in Crohn's disease, there can be palpable abdominal mass, mainly in the right iliac fossa. There can be palpable abdominal mass, which can be observed in the patients. In malnutrition signs are common in both the patients. So there is serum electrolyte disturbance in those patients, dehydration, because of which fatigue, patients appear pale, weak, and also patients appear thin. So these are common in both the diseases. Now we'll go further into the different subtypes of these diseases and the specific features of those subtypes. So let me discuss the Crohn's disease. So here, Crohn's disease can be again small bowel, ileocecal, or terminal disease. Small bowel, ileocecal, or terminal disease, and colon involvement may also be seen in Crohn's disease. So in the last class, I just said there is uh, there is no colon involvement. Just for a correction, colon involvement can be seen in CD, but only colitis is seen, or only colon and rectum part is uh, being affected, and we can differentiate this through the histological features for ulcerative colitis. So here in Crohn's also we have a different subtype where only colon part is affected and which shows the features of Crohn's disease. And perianal disease in last, which is rare type gastroduodenal and oral disease. So in Crohn's disease type, where small bowel or ileocecal involvement or terminal disease, terminal ileum is seen, or based on the location we can uh, say the Crohn's, which affects these regions, is of one type. So mainly here the features are diarrhea, mucus, abdominal pain, and one more significant feature is borborygmi. Borborygmi is nothing but a large or louder gurgling sound which uh, which occurs because of the bowel movement. If there are large bowel movements, we can hear sometimes the intestinal movements sounds. So such loud bowel movement sounds are known as borborygmi. So borborygmi is uh, one of the manifestation in Crohn's disease. Apart from this, anemia anemia can be observed in these patients. And colitis. In colitis, one significant feature can be seen, that is about 6 loose stools per day. On average, around 6 loose stools per day. Weight loss occurs to the patient. These are the main features involving colitis in Crohn's disease. And perianal disease. Perianal disease can involve the uh, the anal can involve conditions such as anal fissure or anal fistula. Apart from these particular features of Crohn's disease, and gastrointestinal and oral disease involves usually dyspepsia, nausea, vomiting features, and also oral ulceration may be seen rarely, where the patient is unable to take food, or there is even the lack of appetite in those patients. This is rare form of the Crohn's disease. Now, coming to the subtypes and specific features of ulcerative colitis. So, ulcerative colitis can be divided into acute severe disease, the subtype. Second is moderately active. Sorry, this is moderately active disease, acute severe and moderately active disease. And the third one, so acute severe disease, moderately active disease, proctitis, and toxic colitis. So coming to acute severe disease. In acute severe disease, as this is UC, we can observe the main differentiating feature is rectal bleeding. So rectal bleeding and blood in stools can be seen for about 6 loose stools, which includes blood. Here there won't be any blood. Same 6 loose stools are the features for colitis, but here we can see bloody stools, 6 blood stools which are filled with blood. and there are 10 to 20 watery stools, or so there can be, we can say it's an active disease, active severe disease, or acute severe disease, when there are 6 bloody stools or 10 to 20 loose watery stools in the patient. And coming to moderately active disease. Moderately active disease, patient has less than 6 loose stools which are bloody. This is the only main difference. And as said, abdominal mass cannot be seen in UC. Abdominal mass is a feature of Crohn's disease, mainly in this small bowel ileocecal terminal disease. We can see palpable abdominal mass. Here there is less than 6 loose stool, 6 bloody stools per day. And coming to, I'll discuss proctitis first. So toxic colitis is the next form. If left untreated, the severe ulcerative colitis, it turns into the toxic colitis. And toxic colitis, there are chances of 50% of mortality if the patients are not treated even at this stage. So proctitis, so as discussed, ulcerative colitis can affect the rectum and colon. So here, when there is only rectal involvement, only rectum is involved, rectum is affected in UC, we call it proctitis. And if the sigmoid colon and descending colon, so if the sigmoid, yesterday we checked the sigmoid region and the descending colon, if those parts are involved, that means the left side, it's called left-sided colitis. And if the entire colon is affected, we call it pancolitis. So here we are discussing about the rectal thing, that is proctitis. So in case of the proctitis, as rectum is involved, there is active bleeding, and the signs of malnutrition and anemia may be observed in these patients in the subtype of proctitis. Now, we'll further discuss about the extraintestinal manifestations. So these are the manifestations pertaining to the disease. The extraintestinal complications means when when the colon is involved, it can affect many other systems of the body in different ways. Now we'll see in what way the extraintestinal complications occur. Extraintestinal complications. So as discussed, when the large bowel is significantly affected, it can lead to most of the cases, this large bowel involvement can lead to the other organ systems manifestations. So the extraintestinal manifestations can mainly affect the joints, skin, eyes, and the liver. liver along with the biliary system, we can say hepatobiliary system is affected. We'll see what are the conditions, what are the manifestations for these main parts of the body. Just let me explain through the diagrammatic way. The sacrum, coccyx, the pelvic region, and this is the vertebral column. Just for your understanding, I wanted to depict the same through the picture. So, joints, arthropathy. Arthropathy can occur in patients suffering from IBD as a complication. Now, arthropathy here means more than 5 joints, there is arthritis. So, inflammation of joints again develops swelling, redness, and impaired mobility, range of motion. So, this can be seen as an arthropathy in the joints, and there can be the ankylosing spondylitis, inflammation of spinal bones, the inflammation of which involves axial skeleton can occur as a joint manifestations. So ankylosing spondylitis can also occur, and osteopenia. Osteopenia, decrease in count of osteocytes, again can lead to osteoporosis. The bone architecture will also be damaged as a result. So these are some of the manifestations or some of the complications relating to joints which occurs in IBD. And coming to the manifestations of skin. So here in skin we can say there is formation of nodule. If this is hand, for example, this is the external surface of hand. there is development of red nodules, which stay for few days and then disappear, leaving a patch. So leaving a brown color or so. So these nodule development here I am depicting is known as erythema nodosum. Erythema nodosum. Red, swollen, or nodular appearances can be seen on the skin, which stay for few days and disappear and form a brown colored patch later on, are described as erythema. This condition is described as erythema nodosum. And sometimes there can be ulceration of the skin. This is known as pyoderma gangrenosum. Gangrene, where there is reduced supply of blood and oxygen, that ulcerated skin looks dark in color. So this is referred to as a gangrene. So pyoderma. So here there is first formation of pustule, pus secreting uh, structure. So this pustule formation later on ruptures, and then there is development of an ulcer over that area. Hence this is known as pyoderma gangrenosum. And skin also looks pale, and the person looks thin and emaciated, as there is malnutrition, anemia. These features can be seen. This can be observed on the skin as well. Even in the nails can be brittle as a result of anemia, brittle and pale in color. And there can be in joints we can see one more, that is finger clubbing. So it's known as Shamrod's sign, where there is as a joint deformity. One cannot observe this diamond shaped gap between the fingers. You can check through this sign, facing your index fingers together. You can see a small diamond inside, diamond shaped gap. So when there is no gap, it is called finger clubbing. This is also one manifestation of the joint, we can say the joint complication in IBD. And eyes. So eyes, there can be different conditions affecting the eyes. Layer around above the sclera can be inflamed, that is episcleritis or scleritis, and uveitis can also be seen in the uvea region is involved. So episcleritis manifests as itching, burning sensation of eyes. Scleritis, there is gradual loss of vision, and uveitis, headache and blurred vision can be seen as the manifestations of uveitis. These conditions are the complications uh, which arise and affect the eyes. And coming to the liver disease, we can see pericholangitis, hepatitis, and cirrhosis. These are the liver manifestations. And overall, in inflammatory bowel disease, malnutrition is one of the significant uh, manifestations we can see. I'm just rubbing this. Malnutrition. So malnutrition signs can be varied. So there is decreased zinc. So taste alteration can be seen. Decreased calcium and magnesium. We can see muscle tetany, fatigue can be seen when there is decreased iron or B12 or folate deficiency. B12 deficiency can cause anemia, fatigue, pertaining related symptoms. And here, just this is the large intestine. Here, if there is low potassium, so here in the sense, if there is no absorption and there is loss of fluid from the body, diarrhea, low potassium levels can be seen in the body. Low potassium uh, absorption, we can say. Again, this can lead to weakness, lethargy. So these are the signs and symptoms pertaining to the malnutrition. And also vitamin K is reduced. So if there is a wound, there is easy bruising. This is because of decreased vitamin K, decreased vitamin K levels. So these are some of the complications pertaining to the malnutrition which occurs in these patients. In the coming class, we'll discuss further about the diagnosis and treatment. Thank you.